National Environment Agency NEA has commemorated Air Quality Awareness Day with a march past and series of activities, reaffirming its commitment to promoting clean air and sustainable environmental practices while calling on stakeholders and the general public to take collaborative action in reducing air pollution across the country. More in this report by Binta Balajo.
Every breath you take may be costing you more than you think. Officials, staff and stakeholders of the National Environment Agency took to the street in a march past before gathering to confront one of the most silent yet deadly threats facing Gambian today, polluted air. Speakers at the event warned that air pollution is responsible for nearly 7 million premature deaths globally every year, cautioning that the only time most people truly appreciate the value of clean air is when they face themselves in a hospital bed, depending on oxygen and facing the bill for it. Executive Director of the NEA, Dr. Dauda Baji, disclosed that the agency has successfully established 30 air quality monitoring stations across the country since launching its National Air Quality Monitoring Program in 2023. In collaboration with Permanent Health Long the Institute and the Ministry of Health, he cautioned that while air is a free gift, its destruct untimely harms those responsible for polluting it.
Quality remains a critical component of our environmental protection and public health. Clean air is essential for healthy living, sustainable development, and well-being of present and future generations. It is therefore our collective responsibility to protect the atmosphere from pollution and harmful emission. Mr. Chair, the National Environment Agency officially commenced the National Air Quality Monitoring Program in 2023 as part of the statutory mandate to monitor and safeguard our environmental quality in the Gambia. This initiative was implemented through a strong tripartite collaboration involving the National Environment Agency, the Premier Health Long Institute in the US, and the Ministry of Health through the Public Health Directorate. The primary objective of this program is to determine the level of air pollution in our atmosphere and assess its impact on human health and the environment.
The founder of the Permanent Health Long the Institute, Dr. Sunkara Toure, raised the alarm over the deteriorating state of air quality in the Gambia, warning that high pollution levels are directly linked to rising cases of hypertension, cardiovascular disease, and respiratory conditions in the country, calling for urgent action to tackle the growing threat.
Is actually a leading cause of death globally. Every year, about over 7 million people die from air pollution. And half of those deaths are from cardiovascular disease and respiratory diseases, diabetes, kidney failure, and cancer. And so a lot of times when we think about air pollution, it's actually caused by things that we do, vehicular emissions, the Hamatan dust storms, and also waste burning. And I'm so happy to hear that the agency is embarking on initiatives to raise awareness around waste management.